I want to welcome Dr. Derek Griffith, who is the Risa Lavisa Mori Population Health and Health Equity University Professor at the University of Pennsylvania. He also holds appointments in the School of Nursing and the Perelman School of Medicine. Dr. Griffith, what made you fall in love with public health?
This feels like what made me fall in love with hip hop kind of question. So I'm coming to public health from psychology, and in psychology, it was hard for me to study the things and have a hard outcome. At the time when I was coming out of psychology, we were studying stuff like self-esteem and other things that in public health we would see as more intermediate variables. But who lives, who dies, and so forth, I thought were just really more meaningful outcomes. And so as I was able to explore things that were important to me about issues like what it meant to be a man, racial differences, and so forth, that was really what allowed me to sort of fall in love with I guess not hip hop, but with
You
with
don't have to tell
public
people
health.
where I stole my questions from. Can you tell me when in your career you think it was that you fell in love with public health?
Well, I fell in love with her multiple times. I think initially it was as I transitioned as a postdoc, figuring out that my interest in social activism, social change, and so forth, that I could actually make a career in it. That my interest in trying to understand how do we make sense of structural oppression under various whatever names, that you could actually do that and make some sense of it and do something about it. I think as I've sort of grown in my career and then changed over time. So everything from studying anti-racism in health departments and so forth to how do we think about structural racism as a public health and population level problem to how do we think about black men's health and what are the unique conditions and structural conditions that lead us to have this consistently poor health outcomes, pattern of health outcomes. I think each time I've been able to explore different things and now doing more global health policy related stuff, I've kind of found new different reasons to fall in love with her again.
Glad to hear it.
Yes.
How can we in the public health field better reach and engage men of color?
I think by first just talking to them and talking, asking them, where do we find more of you? I think using, yes, AI technology are always going to be great, but nothing seems to work better these days than word of mouth. I mean, there's not just a level of how do we reach them, but if we want to engage them and bring them in, there's some level of credibility that the institutions have to have, that we have to have as individuals or as partners in the work, that only comes with somebody saying, yeah, they're okay, that we actually have to have those kind of relationships to build on.
What does real structural change in health equity look like to you?
It looks like the opportunity to be healthy regardless of who you are, not just now, but creates a conditions where it's sustainable going forward in the future. So most of the time when we talk about structural change, we talk about it or seem to imply it's a moment in time, but we really need to think about what is it that we need to change so that the conditions will stay the same or stay equitable and have the opportunities for people to be healthy 5, 10, 15, 20, 25 years on into the future, and for those changes to be able to continue and persist over time.
How can communities lead and not just participate in health research?
I think it's by having I'm not going to say having the capacity, but having the relationships to demonstrate that they can play a leadership role. Um, I think a lot of it for communities is really opportunities to lead in that space. Communities have unique areas of expertise, lived experience, and just knowledge of the community, the history, the context of what will work in their spaces that we don't tend to fully appreciate and that we need as academics. And often they have a vision for what will work, again, in more of a long-term way than the way that we tend to approach it. We tend to approach change in terms of grant cycles or in terms of sort of things that we can measure in sort of short-term fashions, whereas community partners think of it, how can the generations that come after me, or how are they going to live well? How are my kids, grandkids, and those who are coming further, how are they going to live well too? So I think by demonstrating that they have a vision, they have something that we as academics or other health system partners and other things need and want, and that, you know, as we think about the ways that we're trying to create change and utilize research often to do that, that they can play a key part in that.
Well, Dr. Griffin, I want to thank you for joining Discussions with the Dean here at the American Public Health
It's truly a
Association
pleasure.
2025 annual meeting.
My pleasure.
Thank you.